Vascular are here to teach us about some great options for health.
Dr. Pete, welcome back to Coco. You are here with RIA, and we're going to get into a lot of topics around interventional radiology. But before we do that, what's a day in the life for a doctor like you? What type of procedures are you guys performing?
Yeah, so an interventional radiologist is a minimally invasive surgeon. We do procedures using imaging guidance such as ultrasound, CAT scan, or x-rays. They used to require an open surgery, but now can really be done through a needle stick.
So it sounds like this is a really easy option for folks to find some really good cures to their symptoms and issues that they're having. So what are some of the benefits of taking this route?
Yeah, so by doing these minimally invasive procedures, we can, in most cases, get as good or better clinical benefits as having the open procedure, but it has considerably less pain and downtime associated with the surgery. So patients have a faster recovery.
Okay, awesome. And each time we meet up and chat, you teach us about a different procedure that you can perform to solve some of these issues. So what are you teaching us about today?
Yeah, so today I thought I'd talk about a very common disease, and that's venous disease. Many people consider venous disease to be a cosmetic concern, varicose veins, but venous disease can also cause significant pain and swelling that can really be lifestyle limiting for patients as well.
And when you say pain and swelling, what are the symptoms like? When are they so severe that we should give you guys a call?
Yeah, so in addition to varicose veins that you can see, and sometimes they can be painful, really the pain and swelling that tends to worsen throughout the day. The pain is often described as a deep, dull, aching pain. Towards the later portions of the disease, patients can get dark skin around their ankle. So if you see or have a loved one who has dark skin around their ankle, that is oftentimes caused by venous disease.
And what causes the venous disease itself? When we notice these things, is it a lifestyle change we can make as well?
I'd say most of the issues that cause venous disease are genetic, but people who stand for long periods of time, women get venous disease a little bit more than men, although men get it as well, and women who've had multiple children. Those are kind of the predisposing factors that we see.
Dr. Pete, when it comes to varicose veins, walk us through how to make that first call and what your treatments are like.
Yeah, so varicose veins occur when the blood flows the wrong direction within the superficial veins of your leg. You actually have two systems of veins in your leg. The deep system is by far the most important. It brings 90% of the blood back to the heart. You generally only have problems with your deep veins if you've had a blood clot in the past. The superficial veins are closer to the skin, although you still can't generally see them. And they tend to have problems with the valves within those veins that are supposed to open up to allow the blood to flow up towards your heart, but close down to not allow the blood to flow back down towards your feet. If those valves stop working, the vein basically becomes a hollow cylinder, and when you sit or stand, gravity can pull the blood down towards your ankle. That increases the pressure in those veins, pushes out on the walls of the veins, and causes them to dilate, and that's what a varicose vein is. And it can also push fluid out of the veins, which can cause the leg swelling that I mentioned.
Walk us through the two different types of venous disease.
So I just mentioned the superficial veins, which are the varicose veins. Patients can also have problems with their deep veins. One of those problems can be if someone has an obstruction in the deep veins up in the pelvis. That is called May-Thurner syndrome, and it typically occurs when the vein up in the pelvis that is draining one of your legs, most likely your left leg, is actually squished by an overlying artery. So the artery can squish the vein between the artery and the spine that's right behind it. When that occurs, there's almost an hourglass within the vein where the blood can't get across very easily. That increases the pressure in the leg, and it predisposes patients to either swelling or a left leg blood clot. So if you have left leg only swelling or a blood clot, it's a good idea to be checked out for that. We can treat that with a simple procedure where we place a stent within that vein to hold it open. The second major thing I wanted to mention is if someone has had a blood clot in the past, those clots can actually scar down the veins that they're sitting in. In the past, patients were told that really there's nothing we can do about this, just wear compression stockings. Now we can open up that scar tissue by threading a wire in a catheter and actually ballooning open that scar tissue within the vein. So that can really help patients quite a bit.
And you guys aren't just about venous disease. You can, treat all sorts of issues there at RA. So tell us why we should make that call and what makes you guys stand out.
So at RIA, we are a group of 14 interventional radiologists. We don't just treat varicose vein disease as some of the other vein centers may. We really focus on the whole body venous disease. So the deep veins, the superficial veins, sometimes people have blockages in the vein up in their pelvis or abdomen as well. So we really take a whole body approach.
And I understand you guys actually have a couple different locations where we can find you.
Yes, we have our clinic here where we can do most interventional radiology procedures here in the Denver Tech Center. We also have a clinic up north in northern Colorado as well.
All right. Thank you so much, Dr. Pete.
Thanks for having us.
The doctors at RIA Endovascular are trusted, renowned, and use minimally invasive treatments. If you feel like you're suffering from any of the symptoms related to venous disease, give RIA Endovascular a call at 720-493-3406. Learn your treatment options, and you can learn more at riaendovascular.com.